Omeprazole is a proton pump inhibitor used to treat GERD-associated conditions such as heartburn and gastric acid hypersecretion, and to promote healing of tissue damage and ulcers caused by gastric acid and H. pylori infection. In this video, let's found. What is omeprazole? What is omeprazole used for? Contraindication. What are the side effects of taking omeprazole? How does omeprazole work? How to use omeprazole? What is omeprazole? Omeprazole, sold under the brand names Prilosec and Losec, among others, is a medication used in the treatment of gastroesophageal reflux disease, peptic ulcer disease, and Zollinger, Ellison syndrome. It is also used to prevent upper gastrointestinal bleeding in people who are at high risk. Omeprazole was patented in 1978 and approved for medical use in 1988. It is on the World Health Organization's list of essential medicines. In 2020, it was the 8th most commonly prescribed medication in the United States, with more than 56 million prescriptions. It is available without a prescription in the United States. What is omeprazole used for? Omeprazole, according to the FDA, is a proton pump inhibitor, PPI, used for the following purposes. Treatment of active duodenal ulcer in adults. Eradication of Helicobacter pylori to reduce the risk of duodenal ulcer recurrence in adults. Treatment of benign gastric ulcer in adults. Reduction of risk of upper gastrointestinal, GI, bleeding in critically ill adult patients. Treatment of symptomatic gastroesophageal reflux disease, GERD, in patients 1 year of age and older. Treatment of erosive esophagitis, EE, due to acid-mediated in patients 1 month of age and older. Maintenance of healing of EE due to acid-mediated GERD in patients 1 year of age and older. Pathologic hypersecretory conditions in adults. Contraindication. Omeprazole is contraindicated in patients with a history of hypersensitivity to the drug or any excipients from the dosage form. Hypersensitivity reactions like anaphylactic shock, angioedema, interstitial nephritis, anaphylaxis, urticaria, and bronchospasm may occur. Side effects. Adverse effects occurring in at least 1% of people include central nervous system, headache, 7%, dizziness, 2%. Respiratory, upper respiratory tract infection, 2%, cough, 1%. Gastrointestinal, abdominal pain, 5%, diarrhea, 4%, nausea, 4%, vomiting, 3%, flatulence, 3%, acid regurgitation, 2%, constipation, 2%. Neuromuscular and skeletal, back pain, 1%, weakness, 1%. Dermatologic, 2%. Other concerns related to adverse effects are recurrence of Clostridium difficile associated diarrhea, osteoporosis-related fractures, hypomagnesemia. Pharmacodynamic effects on gastric acid secretion. This drug decreases gastric acid secretion. After oral administration, the onset of the antisecretory effect of omeprazole is usually achieved within 1 hour, with the maximum effect occurring by 2 hours after administration. The inhibitory effect of omeprazole on acid secretion increases with repeated once-daily dosing, reaching a plateau after 4 days. Effects on serum gastrin. In studies of 200 or more patients, serum gastrin levels increased during the first 1 to 2 weeks of daily administration of therapeutic doses of omeprazole. This occurred in a parallel fashion with the inhibition of acid secretion. No further increase in serum gastrin occurred with continued omeprazole administration. Increased gastrin causes enterochromaffin-like cell hyperplasia and increased serum chromogranin A, CGA, levels. The increased CGA may lead to false positive results in diagnostic studies for neuroendocrine tumors. Enterochromaffin-like, ECL, cell effects. Human gastric biopsy samples have been obtained from more than 3,000 pediatric and adult patients treated with omeprazole in long-term clinical studies. The incidence of enterochromaffin-like cell hyperplasia in these studies increased with time, however, no case of ECL cell carcinoids, dysplasia, or neoplasia have been identified in these patients. These studies, however, are of insufficient in power and duration to draw conclusions on the possible influence of long-term administration of omeprazole on the development of any premalignant or malignant conditions. Mechanism of action. Hydrochloric acid, HCl, secretion into the gastric lumen is a process regulated mainly by the H+/K+ ADPase of the proton pump, expressed in high quantities by the parietal cells of the stomach. ADPase is an enzyme on the parietal cell membrane that facilitates hydrogen and potassium exchange through the cell, which normally results in the extrusion of potassium and formation of HCl, gastric acid. Omeprazole is a member of a class of antisecretory compounds, the substituted benzimidazoles, that stop gastric acid secretion by selective inhibition of the H/K+ ADPase enzyme system. Proton pump inhibitors such as omeprazole bind covalently to cysteine residues via disulfide bridges on the alpha subunit of the H+/K+ ADPase pump, inhibiting gastric acid secretion for up to 36 hours. This antisecretory is dose-related and leads to the inhibition of both basal and stimulated acid secretion, regardless of the stimulus. Mechanism of H. pylori eradication. Peptic ulcer disease, PUD, is frequently associated with Helicobacter pylori bacterial infection, NSAIDs. The treatment of H. infection may include the addition of omeprazole or other proton pump inhibitors as part of the treatment regimen. H. pylori replicates most effectively at a neutral pH. Acid inhibition in H. pylori eradication therapy, including proton pump inhibitors such as omeprazole, raises gastric pH, discouraging the growth of H. pylori. It is generally believed that proton pump inhibitors inhibit the urease enzyme, which increases the pathogenesis of H. pylori in gastric acid-related conditions. Half-life. 0.5 to 1 hour, healthy subjects, delayed release capsule. Approximately 3 hours, hepatic impairment. Dose. Duodenal ulcer. 20 mg POQ day for 4 to 8 weeks. Safety and efficacy of omeprazole for maintenance treatment past 1 year not established. Helicobacter pylori infection. Various regimens exist of PPIs combined with antibiotics. An example is listed below. 20 mg POQ 12HR for 10 days, with amoxicillin 1000 mg POQ 12HR, and clarithromycin 500 mg POQ 12HR for 10 to 14 days. Dose iterations. This regimen is available as a prepackaged 10-day supply of omeprazole, amoxicillin, and clarithromycin from Deva Farms Inc. for eradication of H. pylori. Gastric ulcer. 40 mg POQ day for 4 to 8 weeks. GERD. 20 mg POQ day for 4 weeks. Erosive esophagitis. 20 mg POQ day for 4 to 8 weeks. Maintenance. 20 mg POQ day for up to 1 year. Hypersecretory conditions, for example, Zollinger-Ellison syndrome. 60 mg POQ day, initial, up to 360 mg per day, divided Q8HR/PO. If dose greater than 80 mg, divide it. Safety advice. Despite being labeled as a pregnancy category C drug by the FDA, many studies have demonstrated that omeprazole is safe in pregnant women, as discussed above. In fact, the majority of safety data on the use of PPI therapy in pregnant GERD patients involve omeprazole because it was the first PPI that was available. That's all the information about omeprazole we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.